My name's Darrell Crawford. I'm the main professor of medicine at the University of Queensland and director of research at the Gallipoli Medical Research Institute. So I'm a specialist gastroenterologist with a special interest in diseases of the liver, and help to design and coordinate this exciting project on veterans of the Vietnam War with PTSD. So this was a large study of almost 300 Vietnam veterans, half of the population having PTSD and the other half of the population not having PTSD, and allowed us to compare physical comorbidities between those two groups and identify those symptom complexes that were associated with PTSD. And we did this through symptom questionnaires, but also through a number of really advanced laboratory and diagnostic techniques to evaluate systemic body organ systems. Our results were really quite interesting and identified a number of comorbidities associated with PTSD. The highlight ones really are that patients with PTSD have a higher rate of respiratory and particularly sleep problems. They have a higher rate of gastrointestinal problems, particularly symptoms like reflux, dyspepsia, altered bowel habits. They have a higher rate of having abnormal liver texture on ultrasound examination, probably related to fatty liver disease or alcoholic liver injury. In addition to this, they had a much higher rate of history of myocardial infarction than the patients with PTSD. And again, some of that risk can be attributed to lifestyle factors as well, I think. So they were the headline symptoms are really related to sleep and respiratory disturbances, gastrointestinal and liver abnormalities, as well as a high rate of cardiovascular disease. Well, all of these are long-term symptoms really for patients with PTSD. I think the important message here really is that when general practitioners are looking after patients with PTSD, they should see it as a more systemic disorder with a cluster of symptoms and underlying chronic illnesses that are associated with PTSD that general practitioners should search for and look to investigate appropriately and look for symptom control to improve the quality of life of the patients with PTSD. Particularly with cardiovascular disease, that the chance of patients having myocardial infarction was about fourfold greater in the patients with PTSD than the rest of the population. And the other symptoms that I've described and the other conditions that I've described, you see a relative risk of about 2 to 3-fold. So they occur at a much greater frequency in these patients with PTSD than in the patients without PTSD. Well, I think for the general practitioner, it's important to be aware of the common symptom associations, as I've discussed. And I think it's important that that information is conveyed to the patients with PTSD so that you reassure them that a lot of the physical symptoms they're experiencing are part of the psychological illness of PTSD, and that we can pay attention to these symptoms and we can discuss them with the affected patients, consider which investigations might be appropriate. But I think there's a deal of reassurance for patients with PTSD with the knowledge that some of these symptoms, which really they may not relate to their psychological problems at all, are in fact quite common in that population. I think that's really the cornerstone of treatment. The general practitioner should search for these symptom complexes in their patients with PTSD. They will need investigation because some of them are alert symptoms, like the development of gastrointestinal symptoms in patients who are 40 or 50 do require investigation. So the general practitioners should investigate as appropriate and refer as appropriate to specialists for proper evaluation of these symptom complexes. The sleep issue, in addition to the gastrointestinal symptoms, often sleep studies or advice about sleep patterns and sleep health, if you like, is going to have a positive impact on the quality of life of the patients with PTSD. Well, I think it is probably the words I would say to the general practitioner community really is that this is probably the major health problem in patients with PTSD at the moment. It's interesting to me that 50 years after the Vietnam War, we are still seeing the physical comorbidities of PTSD, and that they should be searched for in all of the veteran populations. And obviously the emerging veterans, the young veterans returning from the more recent campaigns, require a lot of attention as well. And I suspect that these symptom complexes are not restricted to the Vietnam veterans. So I think that when general practitioners are seeing any veterans, that they should really address this issue of PTSD and its physical comorbidities.